then that is avoided.
Mm-hmm.
So again, that's something which was possible for us when we started. And we also have one more musical event that we have with Shankar Mahadevan Academy. And there are musical events organized by them. And the professionals do come in and sing for the senior citizens, and it's a free of cost event. So I would like to encourage all of those who are the senior citizens and who are fond of music, they should be a part of it. And even the memory cafes, it's an open invitation to all those who would like to be a part of it, and even those who would like to volunteer for such memory cafes. There used to be volunteers, we used to dance at times together with the senior citizens. We used to have musical activities at times, we used to sing along with the senior citizens, and they used to have a lot of fun. So yeah.
So these organizations are really doing good.
Yeah, yes, sir. Yes, sir.
And now again, I would like to go to Alzheimer's and ask one question to Dr. Prem. Sir, is early detection of the disease very important?
Yeah, again, there is another, yeah. Yeah, thank you, sir. I mean, although we have to, I hope by now you have understood the three aspects. One is what we have said, that the care of Alzheimer's can actually take place in the hospital, maybe early diagnosis. Hospital is not ideally the place always for a person with Alzheimer's disease. Then home can be taken care of. Then in daycare, it can be taken care of. And we also got a perspective from Sehbab where assisted living sort of comes in, so they can be taken care of. So there are multiple ways that care. I mean, and what I'm saying is connected to the question, because one has to understand that the earlier you detect the disease, the more easily you are able to plan all this, as particularly for the family and the caregiver. So we always think when we are treating a person with dementia or Alzheimer's, let me stick to Alzheimer's, is you are not only treating the person, you're also having a close connection with the caregiver. You might have to undergo, who might have to undergo a lot of caregiver stress, not necessarily taking care of them, but how to take care of them, whether it's sort of in what level, whether it's in the hospital or elsewhere. So when we detect earlier, it's always easy for the family also to plan. And the planning is in a lot of ways. One is there could be creation of a will as it comes later, legalities which are involved. Then if we know that the disease is progressing more, then planning the end of life care. Then to understand that at what stage they will not be able to take care themselves and they might need a professional caregiver. Understanding the fact, again, maybe the professional caregiver also might not be enough. Then they might actually have to go for an assisted living. Another important thing is that all this time, my job as a geriatrician is to make sure that the caregiver has support throughout along with the patient, because they can go through various stages. One is there could be a stage of denial that my own father, mother, grandfather might actually have Alzheimer's. So once they get out of that, then they read about the disease more. So uske baare mein padhte, so when knowledge increases, they get scared even more that this can happen and this cannot happen. So then they ask more. And we are here obviously to sort of allay all their fears that how they have to take it. So early detection is also important in general as well. So everybody in general above 55 should get your memory screening done. Maximum, it will detect that you are normal. If you're not, and there are little domains in which you might not be, for example, you're forgetting names, sometimes it comes back, maybe forgetting keys, maybe forgetting particular things, then you can obviously give yourselves memory aids or train yourselves, retrain. We have to keep retraining ourselves to actually get better and preserving the memory you have, which of course I will come to later. But early diagnosis is not only for the diagnosis, but it is for the fact that better care can be planned. And this is a continuum of care through different levels. So I will take this platform to make the elders also and the caregivers understand that there is care available for a person with Alzheimer's disease at different levels. So you should not say that at any level we might not be able to take care of that particular person. And that's why we are here along with, of course, sister organizations. Then training and education also goes a lot, whether it's educating the caregiver who is taking care, whether it's educating the psychologist who is taking care of that particular person. Not everybody is trained in taking care of Alzheimer's disease, let alone communicating with them. That is a different ball game completely. So communication is also important. So soft skills and of course knowing how to manage. And as Jaslin was just saying, you cannot have fixed plans. And again, not having fixed plans needs an earlier diagnosis, because you can plan better when you cannot have. So the later the diagnosis, you might not be able to do much. You might have to control the symptoms and you will not get an opportunity maybe to even try to put the disease in plateau. Then I'm in a firm believer that pharmacological and non-pharmacological intervention should be started at the same time, and not pehle trial dete hain dawai ka and then we will see. So that's how you give a holistic care for a person with Alzheimer's. So let me reiterate, care is available and focus should be on care along with cure, or not only on cure, because you might not be able to completely reverse the disease. Maybe someday we will be talking about it, that the disease is reversed or reversible, but risk factors are, which of course I will come to later.
Thank you, sir. Thank you for the information. Now I would like to ask Bhasin again, because Bhasin?
Yes, sir.
Just I want to ask you one thing, that how do you deal with the behavioral changes of your residents? Because today also Ami Shah was to come and you have come in her place. It is because of some problem, isn't it?
Yes.
How do you deal with these problems?
So these problems have to be just taken up as they come. I mean, again, as I have said, we cannot plan it. If, say, for an example, say a Baba is very cranky today. I mean, he doesn't want to eat what has been made. So we just sit with him. We try to calm him down. Do you wish to eat something else? Or if he says, if he's a person who likes something good food, outside food, we'll order for him, just to try and calm him down. Or there are times that they do not want to talk to you, just they want to be alone. So we leave them for a half an hour or so. Then we go back to them. With time, they become like family. So we try and understand them. We understand their mood swings. So as in, if I have my grandparents at home, I know them from, say, my childhood. I know their tantrums. So that is how we learn. We understand them. So there are times when there are some adults who do not want to be left alone. They're throwing tantrums, but only because they want somebody to sit with them. And there are others who just want to be left alone. So it is for us to gauge, like, who is wanting what.
Yeah.
So that is how we deal with their behavior. Somebody will have a behavior issue. Somebody will have a anger issue. Somebody will just not talk. So yeah, everybody has.
There are so many issues, and sometimes they are physically aggressive, agitate, isn't it?
Yes, sir. Physically aggressive, definitely. There are a few who are. But then if you sit with them, calmly make them understand what is happening. Or my first experience in this is, you're not supposed to tell them, you're forgetting something. Or right now, it's okay if you've forgotten. No, our approach should be that if you've forgotten, it's okay. It'll come to you maybe in half an hour's time, maybe in 1 hour's time. And that works. Why? Because obviously, because of the disease, they forget that they were trying to think of something. So at that moment, they calm down. Yes, it will come to us. We are very normal. Being a normal human being, you might forget something. It will come back to you maybe in half an hour's time, maybe an hour's time. But by that hour time, they would forget that they were forgetting something.
Okay.
So it is very spontaneously, you have to deal with their behavior pattern. And if they are getting aggressive, yes, we do take that aggression, but then we cannot retaliate to it in the same way.
In case of Alzheimer patients, sometimes while wandering, they go away, they get lost. So what do you do with such residents?
So as of now, we've been very fortunate. This has not happened with us.
Not happened, okay.
Because the staff is very well trained that, they have to be there. They have to be present. They very well identify that this person has Alzheimer's, and they have the tendency to move about, wander about. So right now, there is nobody who has wandered, but the staff is very well trained to be careful about that.
Good.
Yeah, Purohit, sir, I just want to add a couple of points on this. Just one thing I wanted to say is we have to not forget, we are not treating the disease here. There is a person behind the disease. So if you keep thinking about the Alzheimer's part, then we might forget that there is actually a person. So the person deserves dignity and care. So when we care of such patients, it becomes easier. Secondly, about wandering, sometimes it works in actually allowing them to wander as well, but in those paths which might be there in that particular assisted living place, and it might be advantageous because sometimes you not allowing them wandering, by that I mean there is actually path and somebody is going with them, not that they're just wandering out of the assisted living facility itself. Because sometimes when you stop behaviors like that forcibly, that can be triggers for behavioral disturbances even more. So I just wanted to highlight these 2 points. Thank you.
Yeah. Now, Madhura, your organization has a role here. How do you design the activities for, what aspects do you consider for designing your activities?
First of
Can
all,
you just tell me in brief?
yes.
Yeah.
Sure. So first thing we have to see is the person's routine. Are we managing, what are the activities they have set for themselves in the routine and the family members? And then according to that, we have to see the person's likes, dislikes. What are they preferring? Some people may not like the brain teaser activity, let's say. They would prefer an art activity because they are more interested into art. So we would give them that preference, choice. But however, we try to manage all the activities in that 1 hour session usually. And we have to understand that the attention span of the person with dementia is relatively lesser. So for each activity, let's say we give 15 minutes. Even if it's a 1 hour session, we plan our session according to 15 minutes for each activity. For them to sustain that attention span and to focus on that particular activity throughout can be frustrating, and it more than just stimulating their brain. So we have to provide with a variety of activities. Then we also see the profession that they have worked, because let's say they were working and all of a sudden now they are retired for so long. So that particular thing we also try to bring in, where they were they had mastered in certain aspects and they were able to implement those skills and they still have those skills. Like I've seen one of my friend who used to stitch, and she did it as a part-time job kind of thing, just support her household in her young days. But then even if now she had the diagnosis, she was still able to make beautiful wallets in the session. That 1 hour session, I asked her to make me learn because I was trying to build rapport with her. So initially I struggled with the rapport part, but as soon as I gave her chance to showcase her talent, she was okay with me, my presence around her life, let's say. So that's something we have to consider, their interest, their even the profession. And sometimes like teachers would prefer to teach you, so then you have to give that authority or control, because they have had that experience throughout in their life, and they want you to give that power. That need for power still is there as a teacher or a authority. So that's something we have to identify the client's needs as well as their skills. What are they able to do, and we focus maximum on the skills rather than just letting them do the activities just for the sake of the structure. Instead of that, we give them that chance. Okay, this is something which you don't like, we will do that for some time, let's say for 5 minutes. If you don't like art, I will do it at the end of the session for just 5 minutes, but rest of the time we do try to involve activities which they are interested in. And just because we want to give them exposure, and sometimes they may discover certain things that they have never explored initially, like such activities give them the chance. Okay, I sing well is something which I discovered now. So for them, that is again a trial and error for all of us when we plan the activities, but these are the major aspects we look at while considering the activities. Yeah.
What about activities for brain stimulation?
Brain stimulation, yes. So brain stimulation activities, the basics that would involve would, let's say, reading a book. Then we can also involve, let's say, writing. This is something which we have done in the school. Some of them might love the jigsaw puzzles, so we can try the hands-on with the jigsaw puzzles. But jigsaw puzzles weren't that common back then during that generation. So that's like new exploration for them also. Some might enjoy, some might find it childish. So again, that we have to consider. Is it what my client loving to do it or not? And they respond differently to each activity. You cannot really predict that this is the perfect activity and this is the perfect session that will go. Sometimes it's not about the activity, it's all about their moods also. They might love doing certain activity, but next session they may not even enjoy doing it. Yeah. So that's about it. Yes.
Yeah, yeah, good, good. So now I will again go to Dr. Prem. Dr. Prem, what can be done to improve the brain health?
One of the very important things that Madhura already mentioned is stimulation. So one has to stimulate the brain.
Yeah.
Brain is an organ which gets bored very easily. I mean, so if we do not challenge it, then it gets into a state of, you can say, regression, if that is the right word to use. But if we keep it active, then we are able to create more and more connections, which is obviously known as improving the neuroplasticity of the brain. Yes, the cells tend to get older and they die, but research says that the more you stimulate, the more you're able to create more connections. Now, what can you actually do for it? See, the basic things are always basic. Now, one of the biggest things that happened during COVID was, unfortunately, a lot of people were sedentary and they were not even doing any kind of exercise. Not all older people. A lot of older people were very smart enough to do it. If they were not, there were no parks available at that time, so they were walking up and down in their own homes, or they were using their planned, coordinated walking around in the terrace also. No more than 2 people are there at one time, and they have distance maintaining also. So it's not that they are just randomly doing it. So exercise, that I want to focus on the fact that exercise is always going to be one of the important things. Now that we are in general living longer, and exercise not only after 60, exercise has to start long time back. For example, in the 30s, 40s is where one has to maintain a good lifestyle so that you can make sure that if at all any memory impairment is going to happen, it is ultimately delayed. But it's never too late to start exercise. So at least 150 minutes a week, around 30 minutes per day, and of course maybe a few minutes also in Saturday, Sunday can be done, and it's good for ultimately the brain health. Not only physical exercise is important, mental exercise. Now by mental exercise, I mean stimulating activities. It could be anything. Could be a new art. It could be learning a new language. It as good as brushing from the other hand and writing from your non-dominant hand could be the one which is stimulating your brain. And this is all research proven. Gardening has had very good results in research in which it is supposed to give both a sense of very nice mental peace, which is good for the mental health. And it has also been seen to be very good for improving the memory as well as the brain health in general. Then I think one of the very important things, again, the anecdote is through COVID, is the social engagement. A lot of people got isolated. In fact, dementia cases have only increased or worsened post-COVID because a lot of people had lost social engagement, especially meeting in public. Of course, kudos to older adults. They never stop learning. So that's why we are here on an online platform. So throughout COVID, most older people, even if they didn't know technology, got into technology, and now they always have a choice of either joining in person or maybe away even. And most things that happen are hybrid. So technology actually helped. And that was learning a new skill. Now, social engagement is very important, whether it's your local senior citizen group, or whether it's in a hospital where you're meeting, it's a support group, or whether it is in the park, or whether it is online also, because a lot of people were doing the same thing, meeting online and talking about their day. So that is to a great extent social engagement. And I think that is very, very important. Then mental stimulation, as I already said, we tend to sort of neglect one very important thing, that is sleep. So as you get older, you feel that no, the sleep will be less only. No, nothing like that. You can have good 4 to 5, 6 hours of sleep, but quality sleep is very important. Sleep is important because it rejuvenates you and reorients your memories. It solidifies it. So the more you actually sleep, the better it is. Daytime sleeping should be less. Of course, certain people have something known as obstructive sleep apnea. Jisme there is a blockage in the sort of the breathing tract only. Jiske wajah se, of course, you might not get a lot of sleep in the night. Or the sleep you're getting is not good, and daytime sleepiness is there. That also can be rectified. Then one of the very important things for prevention is stress management. I think mental health is as important for the memory and the brain health as compared to physical as well. So do anything. You should always have some time for yourself. By that I mean it is only for yourself. It could be closing your eyes for half an hour. It could be listening to music. It could be just switching off the light and looking into darkness. But that is your time in which you relax. You are not giving yourself any stress, and you just overlook into giving yourself that break. And finally, health, vascular health, especially risk factors like blood pressure, like diabetes. If you had a history of cardiac disease or stroke, or even cholesterol, you need to take everything, whether it's medications, whether it's lifestyle changes, all these things help. Then other therapies have been seen, which obviously help. One is pet therapy. Having a pet is good. Then even doing some things, mental challenges. Not everybody has to do Scrabble, not everybody has to do puzzles, not everybody has to do Sudoku, but something which is challenging but not boring. If you have an inherent irritation to a thing, for example, I tell you, nahi, aapko Sudoku karna chahiye kyunki wo aapke brain ke liye acha hai, but you will not do it because you don't like it. That does not mean your memory is failing. That is because you don't like it. That's why, as Madhura said, activities are always planned according to the liking of the person and not according to nahi, ye hamara set protocol hai, aapko yehi karna padega. So that doesn't work that way, especially in memory. So remember one thing and help yourself with aids. Not only technology. I know you have the phone will have reminders now that, but that is not enough. Continue to write the to-do list, continue to make sure कि आप हर दिन क्या करना चाहते हैं, फिर वापस जाइए. So I would say एक बार डायरी में लिखिए, दूसरी बार बोर्ड जो रहता है आजकल बोर्ड में भी लिखिए, and then एक रिमाइंडर आपको reinforce करने की. And one thing is, there is something known as writing a diary. कुछ नहीं, reminiscence, sense of gratitude कि नहीं इतना सब कुछ मेरे लाइफ में अच्छा भी हुआ है, ऐसा नहीं कि everything is bad. Remember all those things. Reminiscence automatically makes you positive, and with those positive memories, you are able to preserve your brain health even more. So I think, and more have a lot of experiences, good, bad, learnings are there, whether it's personal, whether it's family. So I think a lot of times take inspiration from your own memory into making sure lose it. And last but not the least, I feel human resource wise, older people are the best companions. They are the most learned, they are the most experienced. So fit older people should always give excellent companionship to people who cannot do things on their own or do have. Last but not the least is the intergenerational bonding. I think the younger person, whether it's recently, there was they showed kids 1 year, 2 years, when they were mixed with people with dementia, the behavior, the light on their face, the enjoyment which was never seen before was seen. And of course, in general also, I always a firm believer that when you make friends, when you learn things, it's not necessarily you have to learn it from people of your age. In fact, the mixture of experience and the exuberance of youth will always help you to challenge yourself, and at the same time for them to look up to you as a mentor. So it works good in both ways. I think so. These are the things which should be sort of taken care, but make sure your health is taken care, and not only the physical health, the mental health, engagement. I think all these three things are very important.
Yes, thank you, sir. Thank you very much. Now I'll go to Basin again.
Yes, sir.
I want to ask you one question. That you have some 40 members in your Sahabhav, isn't it?
Yes, sir.
How do you make them more valued? How do they feel more valued and cared for?
So firstly, we try to accept them as we as their family. Firstly, we try to get that bonding. It is difficult in many cases. It is very easy in many cases. So it's very different for all. But we try to engage them. We try to get their views. As Dr. Prem said that, they are very learned. They have a lot of experience with them. Forget the current disease, but in their past, they have a lot of experience that we can take. So here, what we try to do is we have different festivals going on. So we try to engage them. Acha, Baba, aap batao कि अभी दिवाली आ रही है. What do we do? I have no knowledge. How do we do the preparations? Or Amma, what sweets do we make? Give us some recipes. So we try and engage them in maybe menu preparations. We try and get their help. We actually have activities where we make the decor for the festival. Like Navratri is soon here within 2 days. So now we are just preparing for the decor. It's very easy to pick up stuff from the market and just, place it around. But no, we take around a week's time where we prepare all the decorations. Then a day before we put it up. So, they're sitting around in the dining room and the preparations are being done. So they feel good. So that is how we try and engage them. That is how we, bring more value to them. They feel, they will not feel left out, कि हमको घर वालों ने यहाँ छोड़ दिया है, अभी ये सब कर रहे हैं. No, we try to, tell them that accept it. This is also your house. There are many who come by themselves. ये ऐसे नहीं ऐसे होना चाहिए. And we make it sure that that change is visible to them.
Okay.
उनको वो दिखे कि उन्होंने बोला है ये red color नहीं, ये orange होना चाहिए. Okay, done. We'll change it to orange. So that way they feel more comfortable, more valued, more accepted at this place. And as Dr. Prem had said, the kids, there is a lot of change. Our facility is in the residential area. So we try and get the kids maybe sometime in once a week or twice a week. They come down, they just move around the facility. They do not talk to them. They do not play with them, but they just run around for maybe 5 minutes in the facility. The glow on their faces, they just start laughing. They have that glow that, they see the kids and they are in a different world.
Good.
So that helps.
But with all the activities that you are having in your Sahabhav, do you get stressed or your other staff?
Sir, I will not deny the fact, yes, we do get stressed.
Or whether you do anything to become stress-free in this environment?
There are again two aspects to it. There are days when we are very stressed and, it's like, how do we cope with them? But then there are days when we come so stressed from our own houses and they help us to get stress-free. So there are these two different aspects to it. And when we are stressed, when my staff, yes, they do get stressed because obviously everybody has their own problems at home. But we are training them on a very regular basis. We counsel them. We make sure that, they are very stable up here in their head, that they have to be very kind to them. They have to be accepting them so that they can accept them. Because it's always a mutual. दोनों तरफ से जब तक ताली नहीं बजेगी, तब तक ताली की आवाज नहीं आएगी. So इसलिए हम उनको बहुत ट्रेन करते हैं, बहुत ज्यादा मोटिवेट करते हैं स्टाफ को, क्योंकि हमारा शुरू से मोटो, the core values of Sahabhav are integrity, patience, honesty, and ethics. The staff is very clear on these 4 aspects. And we as managers are always present to counsel them. We are always open. We are with them. We don't sit in our cubicle. We sit with them. We try to counsel them. So that all helps.
Good. Thank you. Now I'll request the participants, if they have got any question or if they want to ask any panelist a specific question, kindly come forward. Because we have discussed a lot about the Alzheimer disease, what is dementia, and how the persons are taken care of. If any question is there, kindly come forward.
I have a question to ask.
Yeah.
Okay.
Kalyanpur.
Yeah.
Yeah.
You see, Dr. Prem spoke about a screen test, for to ascertain whether a person has been affected by dementia, He talked about people forgetting names, initially, but at times they are able to recall those names later. But how does one really determine that dementia has set in for those people? And how accurate are these tests? People, as they age, they keep forgetting something or the other. Does it really mean that now they've become victims of dementia, if I can say so?
Yeah,
Yeah.
so see, as far as the screening is concerned, it's basically done through scales, which are short scales. It could be long scales. Now, we do short scales usually. There are a set of questions where we just try to ascertain, according to, of course, my expertise in elder care, that whether there is actually a problem with old age, and then with old age, with dementia, and is this just maybe a memory loss which is related to an aged person, which can also be there. So and depending on what I find, then we might have to do a bigger scale, so which might take more time. And then, of course, there could be a battery of tests. By that, I mean some bloods are done, or maybe a scan of the brain might be done. Now, the important thing here is, we obviously are talking about Alzheimer's, but if you blanket it as dementias also have reversible causes. So things like hypothyroidism, things like vitamin B12 deficiency, folic acid deficiency, then there's something known as subdural hematoma, in which a person might have actually fallen and the blood collects for days together, but we don't know. And then suddenly we realize the memory is worsening. We do a CT and we see, oh, there is a blood, and you just drain out the blood and then person improves. So the idea of doing a screening and the test, let me be very frank, is always to hope that it is reversible. Because we know that the irreversible ones are the Alzheimer's and the various other causes. So as far as age-related memory loss and dementia is concerned, yes, a lot of people will forget. So that's why I keep saying, keep giving yourself memory cues. It could be through post-it notes. It could be through actually writing it again, what you have to do. But that doesn't necessarily mean it has actually completely started. Yes, if it's actually increasing day by day. For example, memory is not the only thing, as I said. We have had persons who are not able to, maybe just, they are very good with recipes. They make brilliant food, but now they are not able to do it very frequently. So these are small things which one has to see. You cannot put it, nahi, abhi umar ho gayi hai, that's why they are not remembering. Because a person who has been a homemaker, who knows, I mean, as far as I know, most homemakers don't look at a recipe book at all, because it's all fixed in the mind, one thing after the other. But once they start forgetting, then obviously those small things, that's why the red flags have to be sort of seen by the relatives, because a lot of times the older adults themselves will not know. But in aging, it will get back to you. You forget a direction, okay, ek din miss ho gaya, but it will be like, I forgot. Then names you might forget, but you will get back home as, I saw him, but I didn't even remember his name. So things will come back to you. But in a person with dementia, it's a clean slate. Whether they have forgotten you or not is not something they will remember. Again, direction sense goes, and also speech might also be affected. And as if more worsening is there, then behavioral problems might obviously come in. So what I would say is, by screening, as I said, early detection, it helps. If you're okay, then great. We just need to make sure that the memory, you keep stimulating yourself. But apart from that, I think age-related memory loss is something which one should understand what it is. Differentiating is important rather than thinking. I mean, the fear would be, oh my God, I'm going towards dementia, whereas that's not the case. Then there's another question which I will answer immediately, that FTD. I think FTD is one of the, frontotemporal dementia is one of the types in which there could be a combination, usually combination of factors. Now, there could be movement disorders, there could be total disinhibition. A person might have total behavioral issues in which in public also they might not realize they are in public. There might be increased or hypersexuality as well, because the frontal part is the one which sort of is involved with the sexuality. So there might be inappropriate removing of the clothes. So those things, so the behavioral things can be quite glaring. And not having their own control on urine and even feces and doing it anywhere. So those are also things which might come in the later stages of FTD. FTD can be quite difficult, and to a lot of times it is actually told when there is a certain behavioral change, and then the spouse actually says, no, this particular person, is sort of behaving in a very different way. and then we are obviously getting to know. Slightly difficult to treat purely because the behavioral component is huge. So medications, along with, of course, still to a great extent, non-pharmacological therapy can be helpful as well. But yeah, FTD is one of the difficult ones to actually treat.
Thank you.
Anybody else? Any more questions from the audience?
Ma'am, as far as advice for a person who's taking care of FTD, I would say the best would be to actually know what the issues your particular person has, and then only we would be wanting to address, because it can be quite difficult handling it. And in a lot of times, you might actually need a professional to take care. And I have seen certain times in which the professional who comes also leaves, because they are not, there might be cases of actually wherein the behavior is difficult to maintain, but there are medications which can sort of decrease that behavior.
Good evening. Thank you very much. Very nice, interesting lecture. And I think medical personnel, when they have some stress at home, but then when they join duty, they may forget everything and can work happily. When they come with the contact of their own staff or patients, then they forget their all stress at home, whatever is there, and they get mixed up like anything. So that is the thing. Sometimes you can forget your stress also. Medical people who all are coming with stress from home, you said, na? So it is not that they will be in the stress full day with working with the patient. There they will forget everything and they will come to, they will enjoy working.
Yeah, just to